Healthcare. Well, it's something we all have to deal with, isn't it? And sometimes, let's be honest, it feels a bit overwhelming, like trying to find your way through a maze.
Definitely. You want the best care, obviously. But you also want a system that, runs smoothly, respects your time, actually talks to you clearly.
Right. It should feel like it values us, not just our condition.
Absolutely. And that desire for things to work better, it's not just patients feeling that. The doctors, nurses, administrators, everyone in the system wants to optimize things, reduce errors, get the best outcomes. It's a tough environment.
Which brings us perfectly to our deep dive today. Lean healthcare. Maybe you've heard the term. It pops up in discussions about hospital efficiency, quality improvement.
It does. And interestingly, its origins aren't even in medicine. It comes from manufacturing, believe it or not. Toyota, actually. But it's becoming hugely relevant in healthcare now.
So our mission today is to really unpack that. What is lean healthcare? How does it actually work in a hospital or clinic? And crucially, what difference does it make for patients and for the staff?
Exactly. We're aiming to get to the heart of it.
And we've pulled together insights from quite a few places for this. We're looking at Joint Commission International JCI. They're a big name in global quality standards. Also the Lean Six Sigma Institute, NABH in India. That's the National Accreditation Board for Hospitals and Healthcare Providers.
Supremediq Consultancy, NEJM Catalyst, that's the New England Journal of Medicine's innovation arm, PubMed for research, ISQA, the International Society for Quality in Healthcare.
And, of course, general resources on lean itself. So a pretty wide net.
A good mix.
Okay, let's dive in.
Right.
Fundamentally, what's the big idea behind lean healthcare?
At its absolute core, it's about maximizing value for the patient. Everything comes back to that. It's a systematic way of looking at every process and ruthlessly cutting out anything that doesn't add value while boosting efficiency overall.
Maximizing value.
Yeah, think of it like a laser focus on what actually helps the patient get better, have a better experience.
So it's not just about slashing budgets then. That's often the fear, isn't it?
That's a common misconception, yeah. Cost reduction can definitely happen. It's often a byproduct, but it's not the primary driver.
Okay.
Like I said, it comes from the Toyota production system, famous for quality and efficiency. The real pillars are things like continuous improvement, always getting better, a genuine respect for people, both patients and staff, and delivering the absolute best patient care possible.
Okay, continuous improvement, respect for people.
Yeah.
Those sound great, but how do they actually show up? How would I, as a patient, notice the difference?
That's where the 5 core principles of lean come in. They translate those ideas into action. First up is value.
Value, okay.
And this is key. Value has to be defined from the patient's perspective. What do you care about? Getting an appointment quickly.
Yeah, definitely.
Clear communication, understanding your treatment, effective results that actually improve your life. That's value.
Right, because what the hospital might see as value, maybe a fancy new machine, might not be what I value most if I can't get anyone to explain the results clearly.
Exactly. That disconnect is what lean tries to fix. The second principle is the value stream.
Value stream.
This means mapping out your entire journey as a patient, everything, from the first call to make an appointment or walking into the ER, right through treatment, discharge, follow-up, the whole thing.
Mapping the whole process.
Yep. And a key tool here is called value stream mapping, or VSM.
VSM. Sounds a bit corporate speak. What's the basic idea?
Maybe a little, but think of it like drawing a detailed map of your experience, step by step.
Okay.
You visually lay it all out. Booking, waiting, seeing the nurse, seeing the doctor, tests, getting results, treatment plan, everything.
Right.
And then you can clearly see which steps actually add value, like getting the right diagnosis, effective treatment, and which steps are, well, waste.
The things that don't help, like waiting around or filling out the same form 3 times.
Exactly. Those non-value-adding steps, VSM helps pinpoint them. It can even track how long each step takes, where the big delays are. It highlights the bottlenecks.
I can see how that visual map would be super helpful for spotting problems. Okay, so value stream. What's number 3?
Number 3 is flow. Once you've mapped the value stream and spotted the waste, the goal is to make the patient's journey flow smoothly, uninterrupted.
Flow. Less waiting, fewer stops and starts.
Precisely. Minimizing delays, cutting down waiting times for appointments, for test results, for a bed, just waiting in a room, making the whole process feel seamless, less stressful.
Yes, please. Nobody likes being stuck in healthcare limbo. That sounds like a huge win for patients. What's after flow?
The fourth is pull. This is quite a shift in thinking. Instead of pushing work through based on schedules or forecasts, doing things just in case,
Right.
a pull system means the system responds to actual real-time patient demand. Resources, staff time, equipment, supplies are pulled into use only when and where they're actually needed by a patient.
So more responsive, like not running a standard battery of tests on everyone, but waiting to see what this specific patient actually needs based on their symptoms.
Exactly like that. It avoids overproduction of services or stocking things that aren't needed right now. It's demand-driven.
Makes sense.
Huh?
And the fifth principle.
The fifth, and maybe the most crucial for long-term success, is continuous improvement. You might hear the Japanese term Kaizen.
Kaizen, right, I've heard that.
This isn't a one-off project. It's about building a culture where everyone, from top surgeons to the cleaning staff, is constantly looking for small ways to make things better every single day, and they feel empowered to suggest and make those changes.
So it's not just big top-down initiatives, but lots of small improvements bubbling up from the people doing the work.
That's the ideal, yes. It makes the improvements more relevant, more practical, and much more sustainable. It becomes part of the DNA of the place.
Okay, those 5 principles, value, value stream, flow, pull, continuous improvement, give a really good framework. Now, you mentioned waste quite a bit. It seems central to lean. What counts as waste in healthcare?
That's a great question because understanding waste is key. Lean identifies 8 specific types, and there's a handy acronym to remember them. Downtime.
Downtime. Okay, easy enough. Let's break it down. D.
D is for defects. These are mistakes, errors, things that need rework or worse, cause patient harm.
Like what specifically?
Misdiagnoses, medication errors, hospital-acquired infections, even things like billing errors that cause hassle later, anything that isn't right the first time.
Got it. Definitely want to minimize those.
O is overproduction, doing more than is needed right now.
More, like
Ordering unnecessary tests just to be safe, prescribing meds the patient doesn't need yet, maybe even making too many meals that go uneaten, producing services or goods before they're actually required.
Okay, so even well-intentioned actions can be wasteful if they're premature. Next is WA.
WE is waiting. This is a big one for patients. Any time spent waiting unnecessarily.
Waiting for appointments.
Yep. Or waiting for test results, waiting for a doctor, waiting for a bed. But it's also staff waiting for equipment, for information, for approvals. Time wasted. And, studies show patient anxiety and even perceived pain can increase the longer they wait for answers.
Wow, really? That's fascinating. Waiting is definitely a huge frustration.
And in downtime.
N is non-utilized talent. This is about failing to tap into the skills, the knowledge, the ideas of your staff.
How so?
If you have experienced nurses or technicians who see problems every day but aren't asked for input or empowered to suggest improvements, that's a massive waste of potential. Their insights are invaluable.
Right. Not using the brain power you already have. That makes total sense. T.
T stands for transportation. Unnecessary movement of things or people.
Like moving patients between departments.
Exactly. Or moving samples to the lab, meds from the pharmacy, supplies from storage. If the layout is inefficient or processes require lots of back and forth movement, that's waste.
So physical logistics matter. Okay.
I's is inventory. Holding too much stuff, excess supplies. But don't hospitals need lots of supplies?
They need the right supplies and the right amounts. But huge stockpiles tie up money, take up space, risk expiring or becoming obsolete. Think expired drugs, overstocked linens. It's about optimizing inventory, not just having tons of it.
Okay, finding that balance makes sense.
M is motion. This is about unnecessary movement by staff.
How's that different from transportation?
Transportation is moving the patient or materials. Motion is the staff themselves moving inefficiently, like walking extra distances because supplies are stored inconveniently, or the layout of the ward forces backtracking, searching for equipment. Wasted steps, wasted time.
Okay. The ergonomics of the workflow, almost. And the last one, E.
E is extra processing, doing more work than necessary to achieve the desired outcome for the patient. Overcomplicating things.
Like?
Using a complex, expensive test when a simpler one would suffice. Referring a patient to a specialist for something a primary care doc could easily handle. Redundant paperwork entering the same info into multiple systems. It's work that doesn't add proportional value.
Wow. Downtime, defects, overproduction, waiting, non-utilized talent, transportation, inventory motion, extra processing. That really covers a lot of ground, doesn't it? It paints a clear picture of where things can go off track.
It really does, and it gives specific targets to aim for when trying to improve.
So the crucial question then, when organizations do adopt lean and start tackling this downtime waste, what happens? What are the real benefits people see?
the benefits can be pretty substantial, impacting everyone. For patients, the big one is an enhanced experience. Shorter waits, clearer communication, feeling more involved in their care. It feels more patient-centered.
Okay, better experience. What else?
Improved quality and safety. By streamlining processes and reducing those defects we talked about, you inherently cut down on errors and inconsistencies. Care becomes more reliable.
That's huge.
Then there's cost reduction. By eliminating all that waste, the overproduction, excess inventory, rework organizations naturally spend less. Resources are used more effectively.
Right, efficiency savings.
And a benefit that's sometimes overlooked but is really important: increased staff engagement.
How does Lean help with that?
When staff are empowered to identify problems, suggest solutions, and see their ideas make a difference tackling the non-utilized talent waste, they feel more valued, more ownership. Job satisfaction often goes up. It creates a more positive work environment.
Better experience, better quality, lower costs, happier staff. That sounds like the holy grail for healthcare, doesn't it? A real win-win.
It really can be when implemented well.
Do we have any real-world examples, like a hospital that actually did this?
Yes, our research pointed to St. Mary's Hospital. They were facing some pretty common challenges: long wait times that frustrated everyone, workflows that felt clunky and inefficient.
Sounds familiar.
Resource constraints, rising costs, the usual pressures. So they decided to really commit to a lean healthcare approach.
Okay, so what did St. Mary's actually do? How do they apply these principles?
Well, they started with value stream mapping, like we discussed, really digging into how patients move through their system for different conditions.
Mapping those journeys.
Exactly. That helped them pinpoint the major bottlenecks and waste. Then they worked on optimizing those processes, smoothing out the flow. They also made a conscious effort to focus on patient-centered initiatives, improving communication, involving patients more in decisions.
And the staff involvement? The Kaizen part?
Crucial. They actively fostered that culture of continuous improvement, encouraged frontline staff, nurses, doctors, techs to spot problems in their daily work and propose solutions. They didn't just dictate changes from the top.
So they empowered their people. And what happened? Did it work?
The results were pretty impressive, according to the sources. Significant reductions in patient wait times across the board.
That's great.
Which naturally boosted patient satisfaction scores. They also saw enhanced efficiency. They could handle more patients effectively without sacrificing quality.
And the costs?
Cost savings followed, yeah, helping their financial stability. And importantly, staff engagement improved. People felt heard, valued. The CEO, Mr. Shilton, actually specifically credited these staff-led improvements as being key to their turnaround.
That's a fantastic story. It shows it's not just theory. Now, we mentioned Joint Commission International, JCI, earlier. How do they fit into this picture of lean and quality improvement?
JCI is a major global player. They're all about promoting high standards for quality and patient safety worldwide. Their accreditation process is incredibly rigorous.
Is it just about getting a badge?
Not at all. Many hospitals find the process itself is valuable. It forces departments to work together, improve communication, focus on shared goals. It's seen as a team-building exercise, in a way.
Ah, okay.
And their ultimate vision is ambitious. Zero preventable harm for patients. Highly reliable care, every time.
Zero harm. That's a powerful goal. What kind of services does JCI offer to help hospitals move towards that?
They have quite a range. Their main thing is accreditation for hospitals and labs, and interestingly, their lab accreditation now incorporates the ISO 15189 standard, which is a big deal for lab quality globally.
Okay.
But they also offer certifications for specific clinical programs like cancer care or heart failure. They have telehealth certification, which is obviously very relevant now, and even a healthcare sustainability certification working with the Geneva Sustainability Center.
Sustainability, too. Wow, they cover a lot.
Yeah, recognizing that quality care includes environmental responsibility now.
Our sources mentioned some testimonials from JCI-accredited places. What did they say they gained?
Yeah, places like Hong Kong Adventist Hospitals, Burj Al Farha in the UAE, Emirates Specialty Hospital, Corniche Hospital. They talked about similar benefits.
Such as?
Improved teamwork across departments was a big one. Great learning opportunities for staff during the process. Feeling it gave them a competitive edge. Building community trust that JCI seal means something. Better risk management, and fundamentally embedding that culture of safety throughout the organization.
So it really drives internal change, not just external validation. We also mentioned NABH in India, similar role.
Exactly. NABH, the National Accreditation Board for Hospitals and Healthcare Providers, does for India what JCI does more globally. Sets the standards, runs the accreditation programs, drives quality improvement within the Indian healthcare system. Very important body there.
And are there consultants who help hospitals with these accreditation processes and maybe with implementing Lean too?
Yes, definitely. Specialized groups exist. Supremediq Consultancy Private Limited was one mentioned in our sources. They help hospitals prepare for accreditation like NABH, but also implement other best practices, potentially including Lean methodologies, to improve operations and care quality.
Good to know there's support out there. Our notes also mention KaiNexus. What's that? A company.
KaiNexus is actually a software platform. It's specifically designed to help organizations manage their lean and continuous improvement initiatives.
Ah, a tech tool. How does it help?
It provides a central place to track improvement projects across the whole organization. It makes things visible. It helps teams collaborate, share ideas that work, standardize best practices.
So everyone isn't reinventing the wheel.
Precisely. And importantly, it helps measure the impact of these changes. Are they actually working? It often includes tools like digital A3s for problem solving, ways to manage daily huddles, track strategic goals, capture ideas, and visualize progress.
Okay, so it helps organize and scale the Lean efforts. And the last organization was ISQA, International Society for Quality.
In healthcare. Yes, ISQA. They're another major international organization focused purely on promoting healthcare quality improvement globally.
How do they do that?
Through education, sharing knowledge conferences, publications, and they're also involved in accrediting the accreditors, in a sense, and other external evaluation work. They have members in over 70 countries, so it's a big network for spreading quality improvement ideas.
It really sounds like there's a whole ecosystem supporting this move towards lean and better quality in healthcare.
There is, yeah. A growing one.
So if a hospital or clinic leader is listening and thinking, okay, this lean thing sounds promising, what are the absolute must-knows before they jump in? Key considerations.
Probably the most important thing is realizing lean isn't just a toolkit or a project. It's a mindset, a fundamental culture shift.
Not a quick fix.
It's definitely not. It has to become how people think about their work every day. And that requires visible, committed leadership right from the top. Leaders have to champion it, support it, stick with it. Without that, it fizzles out.
Okay, leadership commitment is vital. Where should they start? It sounds like it could be huge.
Good question. Often, the best way is to start small. Pick a specific problem area for a pilot project.
Like?
Maybe the patient discharge process is slow and chaotic, or lab turnaround times are too long, or the appointment system is frustrating. Focus on one area, apply lean principles there, get some wins.
Show that it works on a smaller scale first.
Exactly. Build momentum, learn from the experience, then expand. And critically, you have to go to the Gemba.
Gemba, that Japanese term again.
Yeah, it just means the real place where the work actually happens. You can't understand a process just by looking at data or sitting in meetings.
You have to see it.
You have to go watch the nurses, the doctors, the clerks doing their jobs, talk to them. Observe the flow, see the waste firsthand. That's where the real insights come from.
Get out of the office and onto the floor.
Absolutely. Then you can use tools like value stream mapping and that downtime framework we talked about to really analyze what you're seeing and pinpoint the waste systematically.
And who comes up with the solutions?
This is crucial. Empower the frontline workers. The people doing the work usually know what the problems are and often have great ideas for fixing them.
So involve them directly.
Actively involve them in identifying problems, brainstorming solutions, testing changes. It builds ownership, makes the solutions more practical, and taps into that non-utilized talent. It's essential for success.
It definitely sounds like it takes real effort, real commitment. Changing culture is never easy, is it?
It's not. It takes time, persistence. You'll hit roadblocks. But the potential payoff, really, improving care, efficiency, making things better for both patients and staff, it makes it such a worthwhile journey for organizations serious about excellence.
Okay, so as we wrap up this deep dive on lean healthcare, what are the main things you hope listeners take away?
I think the core message is that lean is relentlessly focused on patient value. It's about systematically stripping away everything that doesn't add value, using principles like continuous improvement and respect for people. Remember, it's not just cost-cutting. It's about optimizing the entire system for better care and experience.
And we saw it's not just theory, right? The St. Mary's example showed real results, shorter waits, better efficiency.
Exactly. And there's a whole support system out there, JCI, NABH, iSquad, tools like Kinexus helping organizations adopt these ideas. But the key is realizing it's a mindset and culture shift, driven by leadership and powered by engaged frontline staff.
So maybe a final thought for our listeners to ponder as they think about their own healthcare experiences.
Yeah, maybe this. How might healthcare delivery truly transform if every decision, every process was constantly evaluated through the lens of, does this genuinely add value for the patient?
Wow.
If that was the guiding question, always, how much could that change things? From scheduling an appointment to complex surgery protocols, what could that future look like?
That's a powerful question to leave us with. Really makes you think.
Yeah.
For anyone wanting to explore this further, definitely check out the resources we mentioned, JCI, the Lean Six Sigma Institute, is NABH, iSquad, looking to lean methodologies more broadly. There's a lot out there.
Absolutely. And just remember, this kind of continuous improvement driven by lean thinking, it's an ongoing journey. It's that constant striving for safer, more efficient, truly patient-centered care.